Hello, this is the Prevalence of HIV/AIDS in Europe by Ben Meyette. So we're going to start right in with some background on AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the most advanced stage of an infection resulting from an HIV virus, which is known as Human Immunodeficiency Syndrome. HIV is the most commonly transmitted through blood or semen. Most cases are the result of sharing a drug needle or having sexual relationships with someone infected with HIV. A lot of these cases are most commonly through poor communities as well, or the homosexual community. HIV attacks and destroys the vital infection fighting cells in the immune system called CD4 cells. The loss of these cells weakens the immune system and is responsible for causing the acquired immunodeficiency syndrome, as we know as AIDS. And it makes it extremely hard for the body to fight off infections and cancers. I like to reference the movie Dallas Buyers Club because it's a great example of somebody that has contracted HIV and is struggling with, keeping a healthy body. Matthew McConaughey plays the person, and he gets extremely skinny and he's coughing a lot because he's always sick, and that's just kind of what your immune system does. It essentially is like shutting down because of all the loss of CD4 cells. In 2011, there were over 10,000 new cases of AIDS in Europe. Notoriously, Ukraine, Estonia, Portugal, and Latvia hold the highest number of citizens living with HIV/AIDS. In Europe, similar to the rest of the modern world, the transmission of AIDS, like I've already said, is through a wide range of activities, but mostly including paid sex, sex between men, intravenous drugs, and mother-to-child transmission. However, recently in Western Europe, the transmission has been found in infected individuals not of that region, which I thought was pretty interesting, just because my maps are only considering citizens of those countries. So I read a study that they had found some transmission through infected individuals not from that region. So AIDS deaths and acquiring could be just a little slanted just because of that data pool, those outliers, really. Treatment of AIDS, I'd just like to give some general information about the treatment. Sadly, AIDS is incurable. There's only one treatment, and that's not necessarily a cure. It's just to weaken the effects that are caused by AIDS. Those effects like weak immune system and losing weight and a bunch of other. Obviously, if you have a weak immune system, it's much easier to pick up any other pathogenic material as well. The treatment is called antiviral therapy, short for ART, and consists of antiviral medications and vitamins to support the immune system while it's kind of shutting down. While ART cannot cure an individual, it can substantially increase an individual's health and life living with HIVs. ART yearly costs are estimated at $21,000, or euros, sorry. Lifetime of buying ART is averaged around 357,000 euros, which is an insane amount of money, obviously. Which brings me to my research question. Does this number of contractions of HIV/AIDS directly correlate with the number of deaths in Europe? Or are the number of deaths due to HIV/AIDS the result of an extraneous variable? My hypothesis is that HIV/AIDS contraction will not directly correlate with the amount of deaths, and the amount of deaths may be influenced by the amount of contractions and extraneous variables, meaning that it's kind of two and two working together to prolong individuals' life. The extraneous variable I will be considering in this research are average income in country X, any country in Europe. That is what X represents. While there are many other extraneous variables, including drug use, education, a bunch of others, due to overwhelming cost of ART, income is the most factor for fighting AIDS. So income will be the only extraneous variable considered in this experiment. I don't want to consider too many because obviously it could make this research much longer presentation, but some of the biggest one is healthcare and cost of ART. Obviously, if ART keeps you, sustained life, then being able to pay for it is a ginormous factor. This is the breakdown of my research question and hypothesis. You have HIV/AIDS contraction in Europe, and then you have the deaths, which both of my maps were the contraction and the deaths. And then we know that the contraction will correlate to deaths. That's a given. Since there is no cure, obviously, if you get AIDS, HIV, you are going to die eventually. Then we have average income, which is an extraneous variable. It's the circle down there. We know that HIV/AIDS and contraction is correlated with average income because it takes money to fight it. But what I'm wondering is if the deaths and the average income, if those two correlate with each other, if they kind of push and pull each other, people with higher income are dying less. All right, so first let's take a look at the HIV/AIDS contraction map for Europe. Europe as a whole, it looks, pretty good. You have Eastern Europe, pretty rocky there as far as the LQ is considered. We have quite a few dark over there, dark purple. It's not good, but when we're looking at the best parts of Europe, you're kind of in this central location here of that yellow, which is really good. You got countries like Germany, just Poland, just doing really well. So we're going to break down the good a little bit more than that. Like I said, you have countries like Germany, Norway, Belgium, Poland, Slovakia, Hungary, Albania, Macedonia. They're all doing really good. They're in that yellow, 0 to 0.25 LQ. So way below 1, which is the norm, which is fantastic. These people are not contracting AIDS much at all. Okay, and so now we're going to get into the east of Europe and the one outlier. So we have Switzerland, which is obviously over a 3 LQ. Very interesting. You would think Switzerland being a rich and first world country that it would have some fighting, some government policy fighting AIDS, but their contraction rate is alarmingly high, especially when you compare them to other countries around them. You have the Ukraine, that's the east, obviously. Moldova. These countries are all very, very over the norm. They're contracting AIDS at an enormously high rate compared to the rest of Europe. Okay, more on Eastern Europe. We have Latvia contracting AIDS, way more than the rest of Europe. Belarus, and then that's just more of the East, kind of showing you a little bit of a trend that there's kind of a problem with HIV/AIDS contraction in the East. Okay, now that we have a general idea of the prevalence of HIV/AIDS contraction in Europe, let's take a look at the HIV/AIDS caused deaths. And when we're talking about caused deaths, we're just talking about AIDS, since AIDS is the last stage of HIV. When someone dies from HIV, it is technically AIDS. Let's talk about the good first, because that's always nice. We have Finland going into 0.01 to 0.25 LQ, so very low compared to the norm. Or Lithuania, then Finland, Norway, Denmark, Ireland, Netherlands at 0 LQ, so no deaths. No deaths for 2011, or at least the LQ was 0. That doesn't mean that there was no deaths, sorry. Germany, looking really good as well. Germany is good in the contraction as well. Czech Republic, doing really good in the deaths, as far as keeping it low. Slovakia, Hungary, Slovenia, Croatia, and Bosnia. As you can see, we still have some of the same Eastern European countries doing poor in the deaths. You got Latvia doing really bad. They're having a ton of deaths. And compared, if you remember, Latvia's contraction rate wasn't black. They were step before that in the LQ, but their death rate is black. So that means more people are dying than it could be poor living standards. It could be a bunch of things. But Switzerland, just black again. Switzerland's definitely got a problem going on over there. And then Moldova, black as well. Not good. And you got the entire eastern side of Europe, as well as Sweden. I couldn't find Sweden's rates for contraction. That information was not available. I checked everywhere, but their death rate I could find, and they were not doing well as compared to the rest of Europe. All right, so now let's talk about key differences between the two maps showing a correlation or not. When observing these maps, we find differences in countries like the Netherlands, Denmark, and Czech Republic. So let's take a look at those countries specifically. This is just an average monthly salary in Europe. It's a map I got offline. It kind of goes through and just shows you. You can see automatically that the eastern side of Europe is poor compared to the west and the middle of Europe. So that's just something to keep in mind as we continue. These are average incomes I looked up specifically for those countries that were key differences in the map. The Netherlands, 25,000 euros. Denmark, 25,000 euros. Czech Republic, 12,000 euros. It's quite a bit lower in Czech Republic than in those other countries there. Again, we're talking about HIV contraction in Europe, and we're talking about specifically, we're going back to contraction map, specifically Czech Republic. It has a 1.57 LQ of contraction in Europe, which is a little high, not too high. One being the norm, it's right there in the middle. It's not doing as well as Germany and Poland around it, but it's doing okay. And then we're talking about Czech Republic deaths in Europe, which are at a 0.17 LQ, which is dramatically lower than 1.57. So as you can see, Czech Republic being a lower average income country, they're not really having a problem with deaths like Switzerland is, who's a high income country. They're not really they're having more people contracted and less people dying. They're under the norm for people dying and over the norm for people contracting AIDS, which is good because that means, in a sense, there's prolonged life there. People with AIDS are living more than they are dying. All right, now we're going to talk about Switzerland, just because obviously it's got something going on in Switzerland here. Contraction is black, not good, and they're a high income country. Switzerland's average yearly income is 67,000 euros, but yet Switzerland's LQ is abnormally high. In terms of what does this mean for my research question, it implies that, obviously contraction and deaths are related. You expect them to be. You can see that with my maps in Eastern Europe. You can see a high contraction in the east, and you can see also high death in the east. But from what I found, money has not been a substantial decreasing factor of deaths. There's still even countries like Czech Republic that aren't making quite a lot of money as far as average income are. Their death LQ is lower than quite a bit lower than their contraction LQ, which is good. So this is just going over the findings. Basically what I just told you. It says, well, this is not scientific evidence. There is an amount of undeniability in these numbers. Although Czech Republic average citizen makes considerably less than Denmark or the Netherlands, it is important to keep inflation rates in mind. For this record year of 2011, AIDS deaths Czech Republic reported at 0.17 LQ, meaning many citizens with HIV/AIDS continue to live, while their contraction rate is on the higher end compared to the rest of Europe. This is rather solid information leaning towards extraneous variables not hindering the life of individuals with HIV/AIDS as much as one might think. While it is important to remember that there are more extraneous variables than average income, like government assistance and healthcare programs sponsored by independent networks specifically for the treatment of AIDS, we should keep in mind that there are drugs that are not cheap, and even when subsidized by the government, money is still important in this battle against AIDS. But it kind of, with my research question, it poses the question, why are these countries so much, why you would think in America money has to be an extraneous variable that is hindering these lives. And if you don't have money, you can't pay for this treatment, and eventually you die. We don't have the healthcare coverage that Europeans have. So I think that that is actually a big deal, a big difference between us Americans and Europeans. And um, while not in Eastern Europe, a lot of people are still dying. They still are AIDS ridden. Uh, you know, in the middle of Europe and even in those some of those countries, the healthcare and support to fight AIDS is much stronger. So that could be a reason, as opposed to why money isn't such a factor there. Back to the research question: Does HIV directly correlate with the number of deaths in Europe, or are the number of deaths due to an extraneous variable? We found strong correlations with HIV/AIDS contractions and AIDS deaths, as one would expect, but rather interestingly, we found little evidence for extraneous variable of money to be a monumental resource for preventing contraction and deaths from HIV/AIDS. Conclusion: Although my experiment showed little evidence, it doesn't mean that there aren't any extraneous variables affecting the death rate of individuals living with HIV/AIDS. Many things can prolong or decrease an individual's life suffering from HIV/AIDS, but we can, with strong evidence, conclude that contracting HIV/AIDS does correlate to the number of AIDS-caused deaths. But in some cases, certain countries like Czech Republic are experiencing a substantially lower amount of AIDS deaths than others contracting HIVs at around that same LQ. So, further research, why is this? Why is Czech Republic doing so well compared to the rest of Europe and other countries? While I don't think it's my responsibility as an undergrad student to figure that out, I think it's a very important question that it's necessary to have further research on to figure out, what is Czech Republic doing so the rest of the European countries and even us Americans and the rest of first world countries fight, and anyone fighting AIDS can help and can learn from what they're doing there that's successful. And here are my sources, and thank you for watching.